Since the moment President Trump stepped back foot on White House property after leaving the hospital last night, he's been downplaying the virus that put him there.
I learned so much about coronavirus, and one thing that's for certain, don't let it dominate you. Don't be afraid of it.
Trump also took to Twitter overnight, claiming, quote, in most populations, the coronavirus is far less lethal, unquote, than the seasonal flu, when in fact CDC data shows more people in the U.S. have died from COVID-19 in the last 7 months than have died from the flu over the last 5 seasons combined. And while the White House physician says the president was healthy enough to leave Walter Reed Medical Center, even he admits the battle isn't over just yet, with many other patients having seen a reversal in their recovery several days after it starts.
Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home. He's returning to a facility, the White House Medical Unit, that's staffed 24/7, top-notch.
So not exactly the same level of care the average person who the president is telling not to fear the virus might get. In fact, the president got not 1 but 3 treatments that are hard for most patients to come by. A high dose of an antibody cocktail, the antiviral remdesivir, and dexamethasone, which is a steroid the World Health Organization advises only for severe or critical COVID cases. Today, the president's physician said in a memo that Trump, quote, reports no symptoms, unquote, but it also took that same doctor 2 days to admit the president needed supplemental oxygen on Friday after his blood oxygen level fell, which was the first of 2 times we know about. And then there's concern about how much the president has been exposing others to the virus. Although most experts say COVID-19 is contagious for around 10 days after symptoms first appear, Trump was seen walking into the White House near several staffers without a mask last night. And of course, on Sunday, he rode in a hermetically sealed vehicle alongside Secret Service agents to wave to supporters. And finally, as for that now infamous Rose Garden event, where the president, first lady, and several others may have first been infected, the White House has reportedly declined to do any real contact tracing and even turned down multiple offers from the CDC to help. To make sense of it all, I'm joined by Dr. Cassandra Pierre, an assistant professor at the BU School of Medicine and acting hospital epidemiologist at Boston Medical Center, and Dr. Abraar Karan, a physician at Brigham and Women's Hospital and Harvard Medical School, who's been helping advise the Massachusetts Department of Public Health on its pandemic response. Thank you both for being here.
Great to be here.
Thanks for having us.
There is so much to talk about, it's hard to know where to start, but I'm hoping that the two of you can treat what the president has done since his diagnosis, not as a sort of political case study, but as a medical one. I would love to get you to break down what the president has done wrong. Not everything, maybe the worst of the things he's done wrong since we learned he was COVID positive. And if there is anything, however slight, that he's done right, I'd love to hear you identify that too. So, Cassandra, do you want to take a first crack at this?
I will be happy to. I think it might take me a little while longer to get to the things that have gone right. But I think right from the start, we knew that something was amiss when we'd heard that they were delayed. There's a delayed disclosure of the diagnosis, that he had initially tested positive, and then while awaiting a second test, was not in quarantine and was potentially exposing others in his orbit. So that is clearly something that put other people at risk. Even before this, even before the diagnosis, we know, and probably don't need to belabor the fact that the strategy of getting tested on some regular basis and not wearing masks and not being physically distanced from others clearly backfired. So that was probably another early misstep. Since that time, unclear to what degree Trump has been involved in his own medical care, but we've seen basically a smorgasbord of medications being given that may or may not be appropriate given his stage of disease. So we can talk more about that, but I think the most egregious thing that we have seen, or things that we have seen, have been both that ride out of the hospital to greet members of his fan base, while clearly still infected and infectious, as well as returning to the White House only days after having received dexamethasone, that treatment you mentioned, which is reserved for those who are have the most severe forms of COVID, who require supplemental oxygen or are ventilated. Just days after receiving this, he's back at the White House, and that is clearly not normal. That is not the standard of care. And in fact, if we, as doctors, administered similar care to our patients, that would be considered malpractice. So many things amiss and awry, and certainly not what we would want to show as the picture of what happens in our healthcare system with COVID.
Abraar, let me ask you, and I think this is so obvious that we might not even need to tackle it, but I also feel like it's important we do. There is now, in the wake of the president's diagnosis and his re-entry into the world, talking points circulating in conservative media to the effect of, well, look, it just goes to show you that there's no point running from this thing. You've just got to, live your life and see what happens, and if you get it, try to beat it, and you probably will. Can you explain to anyone who might be watching our show who is inclined to buy into that idea what is problematic about it?
Absolutely. There are so many things that are problematic about this, but a few things we can focus on. So the president is getting medical care that unfortunately is not even available to every American. The standard of care for patients who have low oxygen levels requiring oxygenation or who are on a ventilator and critically ill would be remdesivir and dexamethasone. Not every patient in this country has immediate access to remdesivir, unfortunately. Additionally, he's also received an experimental monoclonal antibody cocktail, which certainly is not going to be available to the vast majority of patients and is not really even indicated necessarily. So, what we heard was that he was given this out of an abundance of precaution. In addition to this, his case is a single case. So regardless of what happens, whether he ends up getting better, whether he ends up doing worse, extrapolating that case or generalizing it to the average person is not advisable. We know at a population level that this is much more severe than the flu, which again gets back to the problematic sort of content that has been tweeted since he's started recovering a little bit. But I would advise all Americans that, again, listen to the physicians who have seen so many cases, who've treated so many patients, and don't focus on just one single case of the president, who, again, that case is just not going to be representative of what the average American will go through.
Let me ask both of you, what is it like, given the work that you do and the knowledge that you have, what's it like just on a personal level to see the President of the United States putting out the sort of deeply flawed information, I think we could call it disinformation, that he has been, now involving his own diagnosis and what the takeaway should be, but going back to, when he scoffed at the idea of wearing a mask for months and months. What's it like to watch someone in a leadership role like that get things so wrong so repeatedly?
I mean, deeply frustrating probably doesn't begin to cover it. It feels like occasionally I'm in an alternate reality. I think there's usually this thought that for those who have been most resistant to messaging about the importance of infection prevention principles like wearing masks and physically distancing to protect from COVID, that for those individuals it might be the case that experiencing COVID themselves might lead them to believe it. To believe its existence and to warn others about what can be done to protect themselves. And clearly that has not been the case here. We've had spectacles of imagery and shows of strength. And I feel that in addition to the original damaging messages against mask wearing, against doing the things that we need to do to pull together to prevent others from becoming ill, that those people who may have had some initial skepticism have had their thoughts about COVID validated. It seems as though one need not do more than just get a quick evaluation by a doctor, a quick trip to the doctor, to the hospital, and then you're out and you're feeling well in a matter of days. And then you're told, don't let COVID dominate you. When in reality, we know that COVID has been dominating our country. It's the third leading cause of death in the United States. And we have, as you mentioned, 210,000 people who have died as a consequence of it. So again, it feels like living in an alternate reality. We have an alternate, compelling, and widely accepted set of facts that is being ignored in favor of a political show.
Abraar, how about you?
I would say that we need the president to step up and amplify the right public health messages. Period. End of story. We need him to do this. There are so many people in this country who listen to him, and it's his responsibility to amplify the public health messages such as wearing a mask, physically distancing, avoiding crowds, avoiding enclosed spaces with poor ventilation. The CDC just put out guidelines acknowledging the role of aerosol-based spread. And it is so important that as we have so much attention now on COVID because of the president's case, that we actually use this moment to really amplify these public health messages. And, you know, one thing I noted, and we were mentioning, has anything positive come of this, is that the president actually used the word COVID and used the word coronavirus rather than calling it China virus. You know, it's unfortunate, but that is a step forward for him. And I'm really hoping that he actually, rather than downplaying this or trying to make people think it's not a big deal, that he actually focuses on what we can do to help prevent people from getting sick. That is what we need the president to do.
Before we wrap up, I want to ask the two of you about what we're learning about the push to get a vaccine out for COVID as soon as possible. It's my understanding from reporting that I've consumed just as an ordinary citizen that the administration is trying to resist or circumvent FDA oversight as they rush to get a vaccine out as soon as possible. Given what we know now about the administration's vaccine push, would the two of you, do you think, feel comfortable if a vaccine is made available quickly? Would you feel comfortable suggesting it to your patients or even, you know, taking it yourself?
So for long periods of time in the past few months, or at least when the pandemic began, when patients, colleagues, the public would ask, who do I look to for being a source of truth and knowledge at this time, we would point consistently to the CDC, to the FDA, knowing that they have been apolitical, invested in science, and bastions of protection for the U.S. population. And to see those institutions being undermined and eroded has been one of the saddest parts of this pandemic. And so this, I would absolutely would say that I would feel very uneasy about accepting a vaccine or recommending it to patients and family members should the vaccine process, approval process, not go through the steps that the FDA has already set and made public as necessary for approving the COVID vaccine. We know that there are phase 3 trials that are ongoing, and those are necessary to evaluate the efficacy and the safety of this vaccine in populations who are at high risk for COVID and already have a very high skepticism and low reported vaccine acceptance, even ahead of any event of any vaccine being announced. So we know that we have to be very careful, we have to be deliberate in our messaging, and we need to be able to show that these vaccines have good efficacy and safety. And so I will say that I am completely committed to supporting the vaccine distribution process, talking about it with my community, with my patients. If I feel that there is a safe and effective vaccine candidate that's released, but we need to be able to point to the data and the science to show our patients and our community that it does work.
Unfortunately, we have to leave it there. Abraar, if we have you back, I'll try to get your take on the vaccine wherever the effort stands at that time. Doctors Cassandra Pierre and Abraar Karan, thank you both for being here.
Thank you.
Thank you.